Bonds, and I'm going to be the moderator tonight. And I'd love to start with a show of hands of how many of you want to be able to make a living being activists. Awesome. You're in the right place. I hope to help you figure out a little bit of that tonight. So we're going to start by introducing ourselves. I would miss things that these ladies want you to know about themselves. So I'll go first and we'll just move down the line. Like I said, my name is Sera Bonds, and I currently work for the Abortion Access Project, which is an organization based in Cambridge, Massachusetts. I, however, live in the fabulous city of Austin, Texas, and I telecommute. I'm a midwife by training. I have a master's degree in public health, an undergrad in women's studies, and from another small rural state school far away from here. And I grew up in rural Arkansas in East Texas. I spent the last 10 years doing international development work, mostly training midwives in war and disaster areas around the world in different places, and have been doing work supporting Southern, primarily, abortion rights folks for the last couple of years with the Abortion Access Project. I'll let you guys.
I am Omare Ogisi. Is it okay if I'm lazy and stay sitting? Okay. And I am also an employee of the Abortion Access Project, and I reside here in Oklahoma. The type of work that I do for the Abortion Access Project is there are two different projects. I'm probably going to go way over your head. So one is LASSI, which is the Least Access State Initiative. So of course in Oklahoma you have no access, right? So AAP's whole thinking is to work with the system to try to create a change versus doing the grassroots type thing. So I work more with people that are in professional levels, so social workers, other clinicians that may refer out to abortion providers to try to make sure they have the proper information and they're doing referrals the right way. On the other side, I also do training with the Miscarriage Management Project. So this is kind of a sneaky way of exposing doctors in their residency to abortion procedures and training them. However, we call it miscarriage management because when it gets down to it, evacuating the uterus is evacuating the uterus, doesn't matter what you take now. So I have been doing that now for a month, I think actually today.
Yeah, it's your anniversary.
So that's what I'm doing. I formerly was a Planned Parenthood, so I've been doing this work for a long time.
And my name is Cleary. I'm the owner of a place called Birth Matters. It is a childbirth education center and resource center for parents. I'm a certified doula through DONA and a certified doula trainer. And I travel around the country doing trainings for training new people coming up to be doulas. And I've been doing this type of work for about 30 years. And love it, love it, love it, and welcome anybody who's interested to come and join this activism for advocacy for parents, because it's an amazing journey.
So when we were meeting yesterday talking about what we thought would be the most relevant and of interest to y'all as folks who are trying to figure out how to make a living doing this work, we thought there are a couple areas I think that as I was a person trying to find my, when God knows my way is hopefully not done, I have hopefully a ways to go ahead of me, but you know, how I was getting here, I certainly never would have saw my path when I was 20 leading me here. I just knew sort of broadly the kind of work that I wanted to do. And so we got a couple different areas that we wanted to sort of organically talk about with ourselves, and at the end, we'd really like to open this up to be more of a conversation with y'all and QA and that sort of thing rather than just listening to us chat. So we're going to share with y'all our own professional paths, if you will, in our roundabout ways, our walkabouts that led to here. Talk a little bit about the physicality of doing this work and in a modern day and what that looks like. And then the sort of meat of it, the money. So I'll get started. And so I started my professional career as an activist running my feminist campus organization at the University of Montana in Missoula, and working as a highly underpaid abortion counselor at the local abortion clinic. I think I made $4.70, which was a very hard job, as many of you, I'm sure, can relate to. And I learned a lot in that job. I learned about, we did all sorts of stuff, as I'm sure many of you are involved in that sort of stuff in your schools, in your communities. Queer issues, body issues, take back the night, vagina monologues. You learn how to organize events. You learn how to supervise volunteers. You learn about administrative stuff. If you're lucky, you get to write a grant or two. Meanwhile, you're taking classes teaching you about theory and like amazing people who went before you, and anthropology and sociology and literature. It is just such an amazing time in your development. So good. Love it. It's so good. And so when I left there, I went to India, and I knew that I had already been to massage school, and I had already been to midwifery school. I didn't go to college until I was 27. I was one of 2 people from my high school who didn't go directly to college, and luckily I have a mother with a PhD who trusted me that I would go when it was time. I was to contribute and be of use to the world. I did that by making a lot of coffee and smoothies mostly. But I found my way, you know, and I knew that I wanted to be involved with women's health, and I knew I was a feminist, and I knew it wasn't important to me to make a lot of money, but I did want a new Subaru someday that didn't already have 100,000 miles on it when I bought it, and to be able to eat sushi, like not on the night that's like discount night before the fresh fish gets there. Like those are really my goals. So if I can make enough money to do that, I'll be really happy. And so as part of my midwifery training, I went to midwifery school in Oregon, where if any of y'all know anything about midwifery in the Pacific Northwest, it's like the holy land for midwives, and there were more midwives than babies, and you have to have a certain number of births. So that's what took me to India, and where there are lots of babies, lots of babies happening. So in that experience, I ended up at a rural hospital in northern India, where it was me and 3 nurses and a doctor in a 40-bed hospital for 7 million people. And I was very quickly exposed to lots of things. And I cried probably every day for 6 months. Sometimes it was joy, sometimes it was like, holy hell, I can't believe the level of suffering that I am witnessing. But often, very often, it was because my privileged white feminist lens had been thrown on the ground and crashed, and my heart ripped open, and I didn't know what to do with it. And so there I was in this idyllic setting in the Himalaya, trying to figure all of this out and keep babies alive and work with moms, and was like, this is what I want to do. This is absolutely what I want to do. I don't want to go to the home and do home birth. You know, this is what I want to do, although I'm really glad that there are people who are doing that. And these kind of people make it okay for me to go and do the kind of stuff that I've been doing. So then I came back to America, and I went to public health school, when I quickly realized that I needed a master's degree if I was going to make any money. And by making money, I mean if anybody was going to give me a grant to go out and do the kind of stuff, so that I didn't have to like make coffee, sleep in a bedroom with 10 other people on the floor, save every penny so that I could go volunteer in India. I wanted to get paid to go to these places. I didn't need to make a lot, but I needed to make enough. So I went to an incredibly overpriced, ridiculous, elitist public health school, Boston University, where the best part of that experience was the people that I met. You can get the reading list, you can read the books, you can teach yourself to write a grant, you can teach yourself how to do evaluation, you can download it off the internet. What I got out of that experience was sitting in rooms with people who were as energized and passionate about the stuff. It was like the feminist center 5-8 years later. You know, we'd all grown up a little bit, we'd seen a little more, we were a little more focused on what we wanted to do. And so we've all worked together really in various places around the world since then. So while it was super expensive, and I will be paying it off until I'm old, my children will probably be paying it off, it was worth it. So then when I was done with that, I had the audacity to think that I knew how to do things the best, as I am prone to doing. And so I founded an organization rather than going to work for someone else. And I ran that as an unpaid ED for 5 years. And the organization was a lot of the work that I just described to you, training and working with midwives in disaster areas. And so it was like, again, that all of those lessons I had learned in that campus organization on a much bigger scale. I had to do everything. I had to do the administrative, I had to run a board, I had to recruit a board, I had to tell a board what to do, I had to find partners, I had to develop programming, I had to raise the money, I had to do the PR, I had to do everything. So slowly we raised some money, and I hired people to do the stuff, and it was fine, and then life happens, and I got married and had babies, and so I sent the organization off to somebody else and have been off having babies and doing contract work and doing other things. And then it was time to go back to work. And I was living in Texas, and my family is stateside now for a while. My husband's a physician, and we have the blessing and the grace to live in Austin. And so I needed to find a job that was going to allow me flexibility, was going to pay me enough to support essentially like a half-income family on a resident salary, which is my husband's situation. And it was going to be work that meant something to me. And so it took me a year to find this job. And I looked really hard. But I found it. And in the meantime, I did contract work and a little of this and a little of that sometimes was awesome and sometimes wasn't. But I found it, and it's great. And so that's how I got here.
You just made me learn something else. Good. So my journey, it's funny, I actually remembered yesterday, I went to OU, and so I've been doing a lot of reminiscing in the last 24 hours. But I remember enrolling in a women's studies class. I was sharing this with someone earlier, and going into that class the first week, so maybe 2 classes in the week, and realizing these people are weird, this is not me. And I dropped the class.
Welcome back.
Right.
Never ever could have told me back then that this is where I would be. So on that same note, I started at Goddard Health Center. For those of you that are OU students, it's the health center on campus. At the time, we had an organization called Sooner Heat, the Health Education Awareness Team, which was kind of, they call it something different now, but it was the peers on campus that went out and taught your STD presentations, your birth control. We did stress relief, around finals time. So we were in high demand, and there were 2 ladies, sisters, that started this organization, and one of them actually ran the campus organization, and another one had kind of branched off in the Health Science Center and started working. If you're familiar with Oklahoma City, there's a housing complex called Oak Grove, and at the time it had one of the highest teen pregnancy rates in the nation. So I did that for a while, and it was only because I could get credit and get paid to do it. That was my whole reasoning for getting into this work. And while I was doing the health education things on campus, I ended up getting asked to come work part-time for the Oak Grove teen pregnancy prevention program. So money, yes. College, you have no money. So I decided to do that. And in that experience, I worked there for 2 years and actually started to think that maybe I was sheltered in life. I really don't think I was. But I started to get this sense. I was working with a lot of 7th and 8th graders at the time, and they were doing things that I had never even dreamed about. Sleeping with 30-year-old men, and there were times when we would bring the parents in, and the parents totally knew everything that was going on, and that would just blow me away. And so it's like that lens, I like that analogy, kind of got shattered, and I never really even realized that I was privileged because I'm not considered white. So, I always felt like I was on the bad end of everything, although my skin color may present different to other people. So I decided to switch majors. I was a nursing major, taking anatomy with a cadaver. Stressing out about nursing school to the point where I was having really bad problems with my jaw. Got in, I remember my grandmother and my mom coming down. We went through orientation, and nursing school is ridiculously priced over high. And then it just dawned on me, I don't want to do that, which worked out because I can't do vomit, so I later learned that in life. So I decided to switch majors to community health. OU does not offer an undergrad in community health, so I also had an undergrad in a minor in African and African American studies, so I was going to be smart about it and do 2 majors at the same time. So anyway, I went to UCO, got my undergrad, moved back home, and there was no work. I was working at Applebee's. I did a little bit of substitute teaching where they really needed to hire someone, but it was cheaper to pay a substitute. So the journey was long, but I eventually ended up getting on at the Tulsa Health Department, which was yes, this is where I'm going to be, this is the work that I'm doing, but I was working in tobacco control. So my foot was in the door, it was great. long story short about the health department, that situation did not work out. I learned very early on that there is a good old boy system, and so everyone needs to be aware of that, and you always need to look after yourself. And so everything, like my world, came to an end, because that was the dream job if I was going to stay in Tulsa and be with my family. Now I'm being forced to move. And what was crazy was as I was doing this stuff with my situation at the health department, I was actually interviewing for other jobs, trying to find something different so I could walk away from it. And one of the interviews that I had was with Planned Parenthood. I did not get that job, but about, I don't know, 8 months after I finally walked away from the health department, I get this mysterious call from Planned Parenthood. Hey, are you looking for a job? The guy actually happens to be sitting in the room. And it was just like my aha moment. No, my future was not with the health department. It was with Planned Parenthood. This is where I want to be. Teen pregnancy was where I thought I needed to be. I loved working with the teens, and I loved talking about sex. That's just love to do that, and not get charged with anything. So I ended up going and working for Planned Parenthood. And I was there for 5 years, and in my work with Planned Parenthood, I kind of felt underappreciated, but it has come back to like payback big time in that. So in the work, I just want to encourage you. Sometimes, like you said, you worked 5 years without paying. I know I'm jumping ahead, but to encourage you to still stay in it. So the reason I stayed in the long haul with Planned Parenthood was because I loved what I did. You know, all politics aside, there's going to be politics everywhere you go. It was what I was doing, and I had a boss that allowed me to just be free and do the work that I love to do. And I ended up getting a contract with Planned Parenthood. AAP came in and bought half of my time. That paid off. And now I'm a full-time employee with AAP and making what I deserve.
Well, okay, my journey began in, I guess maybe in one unorthodox way, in the current standards today. I started off, I became a mom first. I was married, in the military, we traveled, and it was not long after I had had my first child that I realized during my labor, I needed more than what the hospital had available. And the partner that I brought with me tried. He really did. He went through classes, he thought he knew what he was doing, and it fell so far short from what I needed during my actual labor that I thought there's something really lacking in our healthcare. Women need somebody there who knows what they're going through, who can really connect with them. And so I went to the hospital and I said, I was a Red Cross volunteer, and I said, I'm really interested in labor and delivery. And they're like, really? That'd be wonderful. Well, let's come on up and let's talk to you. And what they realized is like, well, we think we could teach her. So they found somebody that could teach all their classes. So they decided to train me to teach all their classes because they weren't paid extra to do their classes. And I wasn't paid at all to do their classes, and I loved every second of it. So they were very happy. So I was trained by them. I'm great tutelage of this particular hospital. It was a military hospital, and I worked with midwives, I worked with nurses, I worked with physicians through a 2-year program that they taught me as much as they could in 2 years. As their educator, it became pretty obvious very quickly that I wasn't great at it. And so all the families that came through my classes would call me when they were in labor. I need you. And okay, I'd go. So I went to about 100 births in this facility. Probably about 50 of them came through classes, and the other 50 came when the hospital staff were stressed out because they had a mom who was having a difficult time. And they'd call me up at 3 in the morning and say, is there any way you could come in? And so I'd go in and I would work with them. I didn't know that the work that I was doing was actually called a doula. I didn't know that there were other people that did what I did. And I hadn't met a single one of them for 15 years into doing this work, mostly because I traveled around. And as a result, I discovered that there was a formal training program. I went through the formal training program and have had the great opportunity to work with hundreds of families, truly thousands of families through my classes. I taught in hospital-based classes for years and years. And recently, in 2010, the hospital, one of our local hospitals here, the physicians kind of got together and they decided they didn't want their families being taught about risks or benefits to any interventions that they wanted to do. And so they kind of put a gag order on all of the educators that we couldn't teach about the most important aspect of teaching. And I discovered I couldn't do that. I just couldn't do that. So I opened my own birth center, and now I get to teach whatever I want. That's fantastic. I still strive to be very politically correct because that's just who I am. That's just kind of my nature all by itself. And I don't want to step on toes. That's not my goal, and it never has been. Educating people, educating women about trusting their bodies and trusting the process of birth and having appropriate people with them that they should be able to choose who gets to go with them and choosing great care providers. Sometimes we don't know how to do that. And a doula once told me that her belief was that obstetricians and midwives became that for one reason. And it was one of two reasons. Either they loved women or they hated women. And I'd say through my years of experience, I'd say that that's probably true. And sometimes we don't know who we have. I'd kind of like to just ask somebody, to go into an OB's office and go, okay, why did you become an obstetrician? Do you love women? And if the answer is, well, okay, thank you so much for your time. And get the heck out. We need to know who we're dealing with. And in hospitals, they can be so overwhelmingly powerful that sometimes we're coerced into doing things that we really don't want to do. And on the backside of birth, to see somebody that feels empowered about their body and about the power of their body through their birth, it creates amazing parents. So I've had the great opportunity to spend a lot of really valuable time doing that. And I love it, and I'm trying to grow this profession in our state. Training is not a very easy thing to come by because the Oklahoma Board of Private Vocational Schools requires that we become a school in order to teach. And a school is kind of a big deal. So I actually train everywhere around Oklahoma. I go out of the state for all of my trainings as a result of that. And I love doing that too. I love traveling and getting to meet new people. And so we have organizations on all over the world, which is really a pretty exciting thing.
All right, so that's how we got here. So the next thing we thought might be of interest to y'all is sort of like, what does this look like, right? Like, how are you able to actually make a living doing this kind of work? What you've heard two of us talk about here is, screw it, we're going to do it ourselves and create it and build it, which I don't recommend to any of you in the room from where I'm sitting. It's really freaking hard. It's hard. But many of us are sort of prone to that. What you heard from Omare is, like, stick it out. You know, it's worth it. So the physicality of what my life has, like what the work has looked like as I have lived in lots of different places, often managing or working with teams who are not even in the same continent as I am, and in this case not the same state, is Skype. You know, like Skype has changed the world. And you can interface with people all over the place now from the comfort of the local Starbucks or whatever it may be. So, you know, don't think you can't be where you want to be and do this work. The workplace is shifting, and workplace culture and politics are changing a great deal. The organization that Omare and I work for, our headquarter office has 3 people in it, and we are a staff of 7 or 8 now. So everyone else is elsewhere, and all of our consultants, which are anywhere between 30 and 40 of them, we see all of them through Skype. So, you know, this is one organization that is able to put people to work in, I don't know, maybe we're in like 8 or 9 or 10 states right now. And the internet is an amazing tool for that, to help you find those folks and connect. So, you know, we thought we would talk a little bit about the physicality of it, in the sense that what was important to me was flexibility. I wanted to be able, I had a desk job for like a month, and every day driving, I was like, what the hell am I doing? And the place was called the World Trade Center. Like, ooh, change the name of your friggin' building, man. So like, that wasn't gonna work for very long. Some people love going to an office every day. You know, like it's structure, it's separate from your home, which for me is, I have an actual a separate physical space at my house where I lock the door every day and I leave. Omare and I talk about that a lot. Like if your laptop's just there all night, you're like, did I get any, you know, do I need to talk to anything? You know, like, no, you work. So, you know, defining for yourselves what you need in your physicality, I think is an important first step. And figuring out what that works for you guys. Is there anything else I want to say about that?
You just took everything.
I'm sorry.
Probably because we work the same, but I was able early on in my career, and I didn't really reflect on this until yesterday when we had our meeting, was to attach myself to 2 women that were involved in this movement, which I didn't really know it was a movement back then. And they just kind of, I don't know, mentored me to be in the place where I'm at in a strange roundabout way. So I encourage you to find someone like that, and then not only to find someone like that, but once you reach your peak, to find others that you can reach out to and do the same for them. And a lot of times it feels like we're not really doing anything, but I mean, it's like amazing to me when some of the people that I didn't know I was having an effect on come back and say things to me, and I'm like, wow.
Excellent point.
And flexibility. Flexibility sometimes will compensate for the sticking it out and not getting what you're worth. And that's the game that I played with myself throughout the years, is especially after I had my daughter. I had the flexibility. The place that I worked was great. I was able to bring her to work, and of course, until I got back out into the field. So I had a packing place set up at my office, and it was worth that to me to be able to bring her to work. And
financially,
yeah,
you saved on healthcare.
Yeah. Of course, when I went back out and was teaching, I didn't take her with me, but the fact that it was even when she went back to daycare, my schedule was so flexible as to where if I was scheduled to be at a school, I could pick up the phone and reschedule with them, and was allowed to go and take care of my daughter. So that to me was like that handoff on not making the money that I thought I was worth.
I think financially for me, I didn't ever realize after my first birth that I ever attended, I felt like I was at home. Like I couldn't have been more comfortable anywhere. I've never been more comfortable in any spot in the world than in that spot. And in that moment, I knew that that was what I was supposed to do. I felt like if I did what I love, somehow the money would follow, and it really did. But it did take a leap of faith to step out and say, this is what I want to do. I didn't want to be a midwife. I didn't want to be an obstetrician. I really hate charting. I hate it. And I was like, how can I get away from charting? Because everything requires charting. I worked in lactation for a year, and I loved the patients, and I loved the work. I hated charting. And I was like, I would do anything not to have to chart every word somebody says, because then I can't be present. For me, it takes too much of my brain to do that and be present at the same time. So I didn't actually start charging for births until I became a certified doula, when I knew the name and what we did. And it started off kind of shaky. I think I remember feeling like, is it okay to ask, for this amount of money? And it maybe took 2 births for me to go, okay, whatever I decide to charge, it's worth every penny. Because every family afterwards is like, I couldn't have possibly afforded you for what you did for us during our labor and our birth. And after you hear that, and if you know you're really worth something, your time is worth something, your talents are worth something, it does change your ability to very effectively say, this is my fee, and this is why this is my fee. And it has felt very organic and very rewarding on that side of it, I would say.
Thank you for the nice segue into the money bit.
You bet.
So I remember when I graduated from college, in Missoula, there were 4 feminist nonprofits in town. We all knew each other, we all dated each other, we all looked at each other's births, we knew everything about each other. We knew everything about the 8 women who had had those jobs before us, who we saw at the natural food store every week. I mean, we knew everything about each other, and we just like swapped jobs all the time. Like, oh, you need a new board member, oh, I'll come over. Oh, you're gonna go to DC and do this thing? Okay, I'll be ED over here for a while. And we made no money. And we were all up in each other's business, crazy dysfunctional, not awesome, not doing great work. I hope none of you know those people. Very nice people. But we could have been a lot better at taking care of each other and taking care of the work. And so where I'm going with that is that we deserve to make money for what we do. Activism is a career. I can't tell you how many times my mother kept saying to me, when are you going to get a real job? I'm like, "When you get your mother that?" It took me winning an award from someone else that she recognized to be like, oh, my daughter. Just like, wow, all right. So you'll get there. You will get there. But in the meantime, do not be afraid to ask for what you are worth. It's, like Omare said, gotta weigh it, is it worth taking out extra school loans to have an unpaid social work practicum at this place because maybe somebody's gonna be leaving in a year and maybe you can move into that spot? It might be worth that. It might not, so you just have to kind of figure it out. But you're gonna get to a place in your careers where you're gonna need to make real money. And that's gonna come at different points for folks, right? We've all got different things that we have to manage, but don't be afraid to ask for it. And you can raise it, and you can find it if you look hard enough. Like she said, sometimes you gotta leap. Did you want to say something, Tom?
Well, is it okay if I do?
Yeah.
I mean, I just wanted to add that because also you can piece things together.
And
What?
we can't say anything because that was what I had written.
Oh, okay. Go ahead. You talk about it.
We're together for a minute.
I'll let you talk about it.
So exactly, you can piece things together. Go ahead, Mark.
So that's what I did. I was going to talk about contract work. And it kind of, everything about my life in this work has happened by accident. I was doing HIV presentations at a local drug place in Tulsa, and they had openings for someone to come in and teach classes. So yeah, if you Google me, I am a drug counselor. I only did it for 1 hour a week, but that was a contract that I picked up, and it helped supplement. And then along with that came my contract work with the AAP, and my contract work with the AAP turned into 3 separate contracts. So when I pieced it all together, I was making what I was worth, but I will also caution you to still have some time to be sane, because that's what I found out last year was not a very sane year. It took away a lot of things, but you can start, so what Tommy I'm sure was going to say is Tommy has started his own consulting firm, and that's what he does. He pieces together a lot of contracts, and he does that full time, but my problem was I was still working for Planned Parenthood full time while doing all this piecing, because I needed to make what I was worth.
And there are people who are awesome at finding the work. Like, they love to network, they love to go out and meet the people and put the cards in the pocket and, hey, I do this. And then they're socially strategic, as my sister calls them. And they read a room and they figure out who they need to talk to. Those people should totally work for themselves. People who would rather do anything than have to go to a dinner party where they don't know people and walk in and explain who they are in a pithy, compelling way should not do that. That's going to be a really stressful career choice for them. So it's really important for y'all to figure out where you fall in that. And you'll fall in that perhaps at different places in your life. Maybe you'll have children, or maybe you'll have a lot of dogs or a lot of horses or something one day, and you'll need to pay really close attention to that. And you just want to go to a job. You just want to show up, or somebody else is raising your money, and they give you got to be here at 9, and here at 11, and here at noon, and we need this. And you'll do that. And then one day you'll wake up and be like, wow, okay, I think I got a little more time, a little more energy now. I'm going to go do this other stuff for a while. We don't have that career path anymore. It's a myth. I say that. My husband knew he wanted to be a doctor at 8. He's a doctor. He had a path, but most of us don't have paths.
And don't limit your networking to local. with the internet now, I encourage you. So reach out to these big progressive cities that are doing these things. You see Boston is trickling down to Oklahoma. I encourage you to not be discouraged about staying in Oklahoma. Tommy said this yesterday, that if our people that are trained in this movement keep leaving the state of Oklahoma, we will never get better.
And this was the reason for this panel, is that everywhere in the world I have worked. I've worked a lot of fabulous, fabulous places. But I have, in all of those places, even in my best moment, I have known that I was not going to be as effective anywhere but here. It's where I come from. I know this place, and I know this movement culturally in this place. This movement elsewhere, you know, I got to do a lot of reading and I make a lot of assumptions and I miss stuff. But if you can stay where you come from, you're just going to be more effective, and you're going to have more support. You know, these people know you and they know where you come from, and they've got your back most likely in a way that other folks aren't.
And we need more young people in this movement. One of the things that I've learned over the last year and a half is everyone that I meet with is old privileged white women, and not of reproductive age. And they're the ones screaming about our uteruses. Really? What's wrong with this picture? So, I mean, you're right. This is where it came out of. And I just encourage you to think outside of the box. I've done a lot of that, and it's really pushed me to grow here in the last year.
You never know. Last year I did a contract for some architects who wanted to build sustainable housing packaging in disaster areas. I was like, all right, sure, I'll figure out how to do that. You know, but you find your way, you know, and then sometimes the things are going to land or appear in front of you and be like, yes, this is what all that was about. This is why this makes sense for me. It's not always clear.